Hi, I'm Dr. Perkins, and today we're going to talk about respiratory anatomy and bacterial respiratory disease. Here's a picture of the respiratory system. Air passes into the nasal cavity. From there it goes into the pharynx, otherwise known as the throat, into the larynx or voice box, into the trachea or windpipe, and from there the air passes into the bronchi that lead into the lungs, into the bronchioles, and to the microscopic alveoli. From there, the gases pass into the capillaries, which is the bloodstream that carries the oxygen to all cells of the body and will also release carbon dioxide back into the alveoli to be exhaled. The respiratory system is conveniently divided into the upper respiratory tract and the lower respiratory tract. The upper respiratory tract consists of the nasal cavity, the pharynx, the larynx, the middle ear, and the eustachian tube, which is the auditory tube that leads into the throat. It also contains the nasolacrimal ducts, which send tears from the lacrimal glands into the nasal cavity. The lower respiratory tract consists of the trachea or windpipe, the primary bronchi that lead into the lungs. These passages are a major site of infection for microorganisms. Every time you breathe, a party of microorganisms enters your respiratory passages. The average adult inhales over 10,000 liters of microorganisms per day. Your respiratory tract has multiple innate defenses against microorganisms. Innate defenses are the first line of defense in the immune response. Examples of innate defenses would be nose hairs that are a physical barrier to pathogens entering the respiratory tract. The airways, such as the trachea, bronchi, and bronchioles, are also lined with goblet cells that secrete mucus. Mucus provides a sticky trap that prevents microorganisms from entering into your body. The mucus starts in your nose and goes all the way down into your throat and down into your respiratory passages. Antibodies are also secreted in mucus that attack the pathogens. Ciliated mucous membrane also lines the whole lower respiratory system all the way to the respiratory bronchioles. The cilia move with wave-like motions to sweep trapped particles and microorganisms into the throat and into the mouth, where the unwanted debris can be expectorated or spit out. This is called the ciliary escalator or mucociliary escalator. Regardless of these protective measures, pathogens often make their way into the respiratory zone. This consists of the smallest bronchioles, the terminal bronchiole and the respiratory bronchiole that leads into the air sacs, which contain the alveoli and that are surrounded by the capillary beds. Microorganisms usually do not get this far, but if they do, that could lead to an infection called pneumonia. Pneumonia is an infection of the air sacs or alveoli. One mode of protection in the air sacs are macrophages that can phagocytize and destroy pathogens. We are also protected by the lung microbiome. Bacteria such as Prevotella, Veillonella, Streptococcus, and Pseudomonas are actually part of a healthy lung. These bacteria usually prevent unwanted microorganisms because they compete for nutrients, but they can cause disease in immunocompromised patients. Microbes that are not part of microbiota can cause severe disease. An itis is an inflammation or an infection. Let's look at some itises of respiratory tract. For example, pharyngitis, or an inflammation or infection of the pharynx, otherwise known as the throat, or laryngitis, an inflammation or infection of the larynx or voice box. This can affect the ability to speak. Tonsillitis is another inflammation or infection of the respiratory passages, in particular of the tonsils that produce immune cells. Sinusitis is an infection of the sinuses. that lead to the respiratory passages. Sinusitis is an inflammation or infection of the sinuses that can lead to severe pain or headache. Epiglottitis is an inflammation or infection of the epiglottis, and the only life-threatening disease of the upper respiratory tract. Death can result in a few hours from suffocation. Let's look at some bacterial diseases of the upper respiratory tract. Here you have Streptococcus pyogenes, otherwise known as Group A Streptococcus. This is a gram-positive bacteria that is also responsible for skin and soft tissue infections such as impetigo. Symptoms include pharyngitis or local inflammation and swollen lymph nodes in the neck. Group A streptococci secrete enzymes that destroy our immune cells. It is an infection that is treated by penicillin. Rapid immunoassays can identify Streptococcus pyogenes as a cause. Otitis media, otherwise known as an earache, is a complication of the common cold or of any infection of the nose or throat. Pus builds up in the auditory canal due to complications of a common respiratory disease. This puts pressure on the eardrum. This disease commonly occurs in children because they have a short ear canal and it is at a disadvantageous angle, so blockage is easy. Apparently, half of all visits to the pediatrician before the age of 3 are due to otitis media. This can be treated with antibiotics such as amoxicillin. It's caused by a number of bacteria. Streptococcus pneumoniae is the most common. Scarlet fever is caused by a toxin secreted by special strains of Streptococcus pyogenes, an erythrogenic toxin that is specifically produced when S. pyogenes is lysogenized by a bacteriophage. That means a virus called a bacteriophage has infected this bacteria, and that's what causes it to produce a toxin. This results in a distinct red rash in the throat, the mouth, and the skin. This is a rare disease in modern times. Most Streptococcus pyogenes do not produce an erythrogenic toxin. It is now treatable with antibiotics. Another disease of the upper respiratory tract is diphtheria, produced by Corynebacterium diphtheriae. This is a gram-positive bacteria that is transmitted in airborne droplets. It can result in sore throat, malaise, swelling of the neck, and this tough grayish membrane forms in the throat due to dead bacteria and dead bacterial cells. Diphtheria is a Greek word meaning leather that comes from this patch of dead bacteria that you can see in this picture. Corynebacterium diphtheriae can be lysogenized by a phage, in other words, infected by a bacterial virus, and it produces a toxin which can be fatal. Till 1935, this was the leading infectious killer of children in the United States, but the DTaP vaccine came about and has minimized the threat of this disease. Let's look at bacterial diseases of the lower respiratory system. Many of the same diseases from the upper respiratory system are able to descend into the lower respiratory system to cause bronchitis or inflammation of the bronchi. One example of this is whooping cough caused by Bordetella pertussis. The symptoms include mucus buildup that leads to extreme coughing fits where the patient's cough sounds like a whoop. It is such a severe cough that it can lead to physical wounds in adults and brain damage in children. It has a bacterial capsule that is a major factor in its virulence. It destroys ciliated cells in the trachea and can produce a toxin called the pertussis toxin. Mycobacterium tuberculosis causes a disease called tuberculosis. This is characterized by severe blood-tinged cough, fever, and weight loss. The growth of Mycobacterium tuberculosis has an appearance that is mold-like, which is where the name Mycobacterium comes from. MYCO meaning like a fungus. Mycology is the study of fungi. This disease used to be called consumption due to its weight loss symptom. Tuberculosis vaccine is an avirulent form of Mycobacterium tuberculosis. Pneumonia is a term applied to many infections of the lower respiratory system, in particular of the alveoli. You have bacterial pneumonia, fungal pneumonia, and viral pneumonia. Streptococcus pneumoniae is the most common cause of pneumonia. 2/3 of cases are due to Streptococcus pneumoniae. This is called typical pneumonia. Symptoms include fever, wheezing, coughing, chest pains, and weakness. Pneumonia is the leading cause of illness and death among children worldwide. Atypical pneumonia is caused by fungi such as pulmonary aspergillosis, protozoa, and viruses. And I think we'll end there. Thank you for listening.